Hello class, in this video I will talk about chapter 7, which is all about planning for a career in health, what this class is all about, right? So the chapter starts with the categories of who healthcare workers actually are. This includes first, healthcare practitioners and technical occupations such as physicians, speech pathologists, occupational therapists, and clinical lab technologists. A lot of times this is what folks think about when they think about careers in health. Second, healthcare support occupations. So this is medical assistants, physical therapy assistants, and others that provide critical support to healthcare operations, but may not always get all the attention. Third is community and social service occupations such as health educators and social workers, as well as personal care and service occupations such as personal care aides. So these are just a few examples, but generally these occupations can be lumped into those three categories. The chapter mentions the Health Resources and Services Administration, or HESC, which exists to increase the diversity of the healthcare workforce to more closely match the demographics of the U.S. So HESC actually funds the Health Careers Opportunity Program that I oversee at Cal State Fullerton. Cal State Fullerton is one of 20 universities across the whole country that receive the Health Careers Opportunity Program grant in order to strengthen this health career pipeline. So moving on, the chapter then discusses the demand for careers in health. So the healthcare industry is already the largest employer in the US, and the demand for health career personnel or health care personnel is expected to continue growing. The reasons for this include the aging population, which we discussed in chapter 4, more people with health insurance as discussed in chapter 5, and health professionals just reaching retirement age and exiting the health workforce. So the types of careers in demand vary, so I would recommend taking a look at figure 7.1 and table 7.1 for more information. Additionally, you can check out bls.gov, which is the government's repository of labor statistics, and they have all the information there by career. So as previously discussed, health professionals can work in a variety of settings. The chapter goes into these different types of work settings, such as hospitals, offices of health practitioners, nursing and residential care facilities, home health care services, outpatient, laboratory, and other ambulatory care services, and many more. So it's important to note that there actually will be an increase in jobs in non-hospital settings as the industry attempts to decrease the cost of care. So that's one of the things that I'd really like to emphasize in this class, that just because you work in the health industry, that does not mean you have to work in a hospital. There are so many different settings out there, so just keep your mind open. So as you explore health careers, it's also important to think about geographically where you will work. Will you work in a health professional shortage area where there are not enough health professionals based on the population? Will you work in a rural area? Will you work in the community where you grew up? Will you explore a new environment? These are different things to think about, and several scholarship opportunities are available in these areas as the government tries to encourage health professionals to work in underserved areas. So again, thinking about the Health Careers Opportunity Program that HESC funded here at Cal State Fullerton, the idea is for us to develop a pipeline here in North Orange County where there is, which is considered a medically underserved community. So as you begin the process of exploring careers, the textbook provides a useful starting point, but definitely don't stop there. Seek out health professionals to do informational interviews with. You will be required to do that in this class, but I would encourage you to continue looking not just at interviewing one health professional, but as many as you can. You can also do an observation at a clinic. That won't be required for this class, but I do encourage you to do it. volunteer in an outpatient setting or any other kind of health setting, maybe by reading the chapter on the different work sites or hearing from different professionals throughout the semester. Maybe something will sound interesting to you and you'll want to see if there are volunteer opportunities there. Ultimately, just collect as much information as you can to determine if it's truly what you thought it might be and whether it would be a good fit for you. Then once you've selected a career, choosing where you'll get your training is the next important career decision to make. The book asks 2 questions. Number 1, will the school you are interested in prepare you for the career you want? That sounds kind of like common sense, but sometimes the school options that are out there might not be exactly what you're looking for or what you want. Would they specialize in the population that you're interested in? Do they deal with the health issue that you are most interested in? And then second, what will be the cost of your education and what are the sources of financial support? So with student loans being crippling across the country, what are the opportunities that are available for funding your education? Additionally, it's important to note which programs are accredited and to understand whether the occupation itself requires licensure, certification, or registration, and will your program help you in that process. The chapter ends by dispelling several myths when it comes to choosing a career in health. Working in the health industry doesn't mean you have to interact with sick people in a hospital all the time. It doesn't mean you have to love science and math, although there are several occupations that do require a strong science and math background. It doesn't mean you need to dedicate a decade of schooling. It doesn't mean you have to incur massive loans, and ultimately it is not necessarily out of your reach. I hope that as you hear stories from the guest speakers in this class, that more misconceptions will be demystified and you will see your goal of becoming a health professional as not only attainable, but realistic. In this class, I want to highlight as many health professional stories as possible so that you can see the different paths that people have taken to get to where they are, not just what do they do on a daily basis. So with that, good luck with the start of your health career planning.